Hi, my name is Reena Ramsaroop, and I am a pathologist at North Shore Hospital in Auckland. I am also the chair of the Medical Advisory Committee for the Breast Cancer Foundation. Well, a pathologist is a specialized doctor that looks at and characterizes the tumor under the microscope. Biopsy is a sample of the tumor that is taken via a thin needle and is sent to us by a clinician. We can tell the doctor what type of tumor you have and how aggressive it is. The term that we usually use to define aggressiveness is grading. And grading has established criteria, mainly by the Nottingham Breast Group, and we divide the tumors into grade 1 if they are on the lower end of the aggressive spectrum, grade 2 is the middle end, and grade 3 being the higher end of the spectrum. We also tend to label the tumor as according to the stage, how extensively the tumor has spread from the breast into lymph nodes. The stages are commonly 4 for breast cancer, and with stage 1 being a small tumor in the breast, and stage 4 being the tumors that have extended outside the breast and its regional lymph nodes into the distant organs. We all know that parts of our body are drained by lymphatics and blood vessels, and this is to clear away toxic substances. It is done by lymphatics that end up in lymph nodes, and for the breast we have lymph nodes that are located in the armpit. They are called axillary lymph nodes. So when a breast cancer spreads out of the breast tissue, then the first place that it goes to is to the lymph nodes. And we examine these lymph nodes to see if they are involved by breast cancer, and then we call it positive, and if they are not, they are negative. The other characteristic that we look for in the breast cancer is to tell us about the biological features. And we use 3 biological features. The first is the receptor status, and we look at estrogen and progesterone receptors, commonly known as ER and PR receptors. This is a specialized test which we perform in routine laboratories and examined under the microscope, and a score is attached to the test to determine whether the tumor is ER/PR positive or ER/PR negative. If the tumor is positive, then it allows you to be treated with anti-hormone therapies, and the common one being tamoxifen. The other biological marker that we look for is the HER2 status of the breast tumor. And once again, this is a special test performed in routine laboratories, and again, a score is attached to the receptors, and the tumor is labeled as HER2 positive or HER2 negative. The other frequent question we get, especially with all the media hype that is about today, is about BRCA testing and the BRCA status of patients. It is important to know that only 5% of all breast cancers that are diagnosed are related to inherited factors. And the 2 common genes that we look for are BRCA1 and BRCA2. What does this mean? It means that if you have or test positive for a BRCA gene, you have a higher risk of developing breast and ovarian cancers. the risk factors will depend on age of the patient, and cancers that develop associated with the BRCA gene are more aggressive cancers, and they usually occur in young women.